The views and opinions in the following program remain those of the producer or sponsor, and not those of Medford Community Cablevision, its staff, management, board of directors, or other affiliates.
Hi everybody, welcome back to another night of the Pet Network sponsored by Kitty Connection. We're an animal rescue organization located in Medford, Mass. Tonight our guest is Dr. Amy Schroff, and she is the Chief of Staff at Vescone.
Right.
Okay,
Right.
in Waltham. Her expertise is in emergency and critical care, and we also have her other little associate here.
Yes, Maisie.
Maisie. I'm going to tell you something about Dr. Amy Schroff, and she has an education in a degree in biology. She studied at Barnard College, Columbia University in New York, from 1982 to 1986. 1988 to 1992, she was a doctor of veterinary medicine at the University of Pennsylvania, the School of Veterinary Medicine in Philadelphia, PA. Dr. Schroff practiced veterinary medicine in a limited emergency and critical care. She is Chief of Staff and the owner of Veterinary Emergency and Special Center of New England, which is known as Vescone.
Right, that's the acronym.
Dr. Schroff has always worked with animals and has always been her calling to do so. Her extensive years as a veterinary technician, both in the private sector and at the academic level in anesthesia and ophthalmology, have helped to round out her career and be an advocate for excellent veterinary nursing. Upon graduation, Dr. Schroff worked as a research fellow for the Harvard School of Medicine in Beth Israel, while also in private practice. She twice became published as a vaccine researcher in Group B Streptococcus vaccine. Dr. Schroff has since devoted all of her time to the practice of emergency and critical care, as well as the entrepreneurial pursuit of practice ownership. Her professional interests include public speaking, practice development and management, transfusion medicine, as well as wound management and trauma. And we're going to go into some of that tonight. So you have an amazing background there.
Thank you.
I know that we got to meet a while back when we
right.
took one of our kitties,
Kevin.
yes, to Vescone, and this was a cat that was going to probably end up euthanized.
Right.
And because of extensive care, and you were able to help us.
Yeah, he had really bad stomatitis.
Yes.
He had really bad infection and inflammation of his mouth, but we were able to get him proper dental care.
And he's doing well in a home and happy today. So tonight's show, we're happy that we're going to be able to talk about something that's really important. And first, you know, we're in the summer, and we have all of the things that can go wrong with our pets. So we're going to talk about what we can do to keep our pets safe in the summer, first aid kits that are great to have around. So maybe we'll start talking about our first aid kit. And I know you have a lot set up here.
Yeah, we have some things that we keep in it. And we have a pet safety tips brochure that we keep out in our waiting area. And if anybody would like to receive a copy, they can certainly call us or go on our website or email us. We're open 24/7, but call us and see if you'd like to pick up one or come into the practice. And we also have some information on pet safety tips on our website as well, vescone.com. And we offer to the public pet owners first aid classes. So they bring their own pet. They're mainly for dogs, but we offer them once a quarter, and we offer them in other venues as well, like especially for pets. We go out to their different locations. And so people come and they bring their pet, and what's great is they get to learn firsthand from a doctor and a nurse how to manage, do first aid on their own pet. And that's what's so special about it. And the fee that they pay, all the proceeds go to either the Animal Rescue League or it's gone to other shelter organizations. So it's a win-win for everybody.
Yeah, that certainly is.
Yeah.
We should put that on our website so that there are, I never
absolutely.
even knew that there was something like that.
On our website, we also have a schedule of all the first aid classes. We have one coming up, I know, October 3rd, and especially for pets in Sudbury. And we have them coming up at our own practice and also in other
Right, in
locations.
Waltham, too? Okay. And when's the next one in Waltham?
The next one in Waltham, I believe, is in the fall. The exact date, you'll have to check the website.
Okay, definitely will.
So,
That'd be
yeah,
nice.
and one of the things that we talk about, it's a 2-hour class, but one of the things we talk about is putting together a first aid kit. And there are a lot of first aid kits that you can buy, but a lot of the items are very commonplace, and you can pick them up at a local drugstore or, just local Walgreens, CVS, that kind of thing. And what we recommend is just to have, regular bag. It can be a duffel bag. It can be a large Ziploc bag. It can be a bag like this. It happens to be a bag that Frontline donated to us.
Okay.
And I do recommend keeping the pet safety tips in there. We do also will have one of our brochures that we give people when they come to see us. And then also you can just have a quick list of what's in the kit. And this list is also in the pet safety tips brochure. And
so
they're
that
just basic
you can
items.
make sure that if you've used
exactly.
something that
Right,
everything
you can
is always
replace
in
it
there.
or if it expires. And so on this table are a few items that are used commonly. And we can certainly go through a few of them. And so we have some basic bandaging material, and we can talk about bandage placement in a little while. So gauze and rolled gauze, which you can also use as a tourniquet, and bandaging material and tape. There's a thermometer, which is important to know how to take your pet's temperature, which we talk about in the first aid class. There's triple antibiotic ointment cream here. It's just a generic triple antibiotic that you can use for basic wound management. There's a pair of tweezers that are okay for removing ticks, not in ears or eyes or mouths, but to remove on the body.
So these are just regular. That's
these are
not
just
a tick.
No, these are just regular items that you can buy in your drugstore.
Okay.
Benadryl, we have a recommended dose for Benadryl, although I'm not a fan of owners giving medications of any kind without consulting a veterinarian. You can certainly keep Benadryl in the event that your pet has an allergic reaction. And again, we talk about all the reasons for using these things. There's some saline here, which is it's an eye wash saline, which you can use to flush out wounds or even flush out eyes. We have hydrogen peroxide, which can be used to make animals vomit if you need to. It's not necessarily a great antibiotic management tool, but it's useful to have.
Okay. So would they drink it, or you pour it down their mouth?
Well, some animals will drink it.
Really? Wow.
If you mix it with ice cream or something like that, some animals.
So if you think that
will
your
drink it.
your pet has ingested something,
if
and
you know your pet, I mean, the rule with toxicity is you have to, in my opinion, you have to see it. There has to be actual known evidence that they have ingested, whether it be an empty bag of chocolate or a bouquet of flowers that's been torn apart. There has to be known evidence in order to take action to try and make them vomit.
Now, when you say the bouquet of flowers, is there every flower that they would have to be concerned, or just ingesting a whole bunch of flowers is a concern?
There are lilies and tulips. The bulb flowers are we don't really understand why, but they tend to they can put animals into kidney failure.
Oh, really?
Again, so we don't understand, and mostly we see this with cats, but it can, any animal that ingests these plants in particular, and those tend to be common in a bouquet of flowers.
Okay.
But there are other plants out there in the summer that you're, in your garden that can be a problem for dogs and cats. And so we have to be careful about those too. And that, again, that's also something we talk about at the first aid class. We talk about common toxicities, and we also talk about, how to manage them and what to look out for.
Okay. So if somebody had Benadryl in their first aid kit, when would they know to give their pet? What would be a sign that they should give their pet a Benadryl?
Well, typically, Benadryl is an antihistamine, and so in the same way that it's meant to stop an allergic reaction. So typically, if a dog is having an allergic reaction, that's the the species that we see it mostly. Maisie looks nice and smooth. She doesn't have any lumps and bumps all over her, but typically she'll break out, if she has an allergic reaction to something, she'll break out in hives, just like people do.
Okay.
And there'll be lumps and bumps, potentially all over her body. Sometimes her muzzle and her ears and her face will swell. And that's usually the first thing that people see. So if that's the case, and you can have that secondary to a bee sting or an insect bite, or they come in contact with some allergen that causes them to have this reaction, giving them Benadryl, again, with the advice of a veterinarian, is a good idea.
Basically, somebody should not just give the dog Benadryl until they saw something.
Right, exactly. So exactly. So it's not that this kid is not meant to be a bag of tricks that we are going to guess which thing should we give, not knowing what the situation is.
But if they saw some of those
absolutely,
side
if they
effects,
see, if they see those symptoms,
they can't reach their vet, give them a Benadryl.
Right, but we're open 24/7. Maisie, come here, buddy. Come here, Maze. Hey. We're open 24. I can talk that way on camera.
Yes,
it's allowed because of my degree, because of my advanced degree. But we're open 24/7, and we have a live person that answers the phone 24/7, and so we can answer that question for you. The other thing to consider is the National Animal Poison Control Center, which is also in this safety first aid pamphlet. And also they have a wonderful website. They're available 24 hours a day, 7 days a week. And in the event that you are concerned about ingestion of any substance, you can certainly contact them as well. They'll give you advice on, they have a huge list of toxic drugs and doses and plants and all kinds of interesting things. So which is really helpful. But the idea is, and this is one part of the first aid class, but we talk a lot about how to recognize that there's a problem.
Okay. And what's the necktie for?
So the necktie or even the gauze can be used as a tourniquet. So we talk about hemorrhage or bleeding control, and so this can be used as a tourniquet to stop bleeding in a leg. And same thing with a tie. These are just things you can use, a tie or pantyhose if anybody wears those anymore.
And
or a shoelace.
If there's severe bleeding?
Yes, if there's severe bleeding and you need to stop the bleeding, then we talk about how to put this on.
Okay.
And how long it can stay on, and how often to check it, and that kind of thing. And we usually talk about placing a tourniquet along with placing a bandage.
Okay.
So we give owners that information on how to place a bandage too.
Okay.
So and we can do that. We can certainly do that on Maisie if she'll sit still.
Okay. Should we do some of this now, or did you want to do something a little later?
No, however you want to do it. We can do it now.
Okay. Why don't we're going to have our table come over?
Yeah, let's do that.
Let's do Maisie up
there,
and we'll do a little hands-on. So
we'll just move some of those brochures out of the way. And
thank you, Dan. And I'm going to get I don't have my scrubs on. I'll get my little apron on.
Okay, your apron.
Okay.
And then we also have a little. We have the dollar that the dollar that I found.
It's going to be the lucky dollar.
Yeah. right, exactly. Okay, Maisie, come here, buddy. So I'm going to have you probably hold her. You know what? I'm going to probably switch places with you. Let's do that.
Sure.
And I also want my mic to be able to
Maisie,
come as far as I need it to.
How old is Maisie?
We don't really know. She was living in New Hampshire, living outside, and she was desperately in need of a home.
Oh, and you were one lucky girl. Huh? Yes, and she's a love bug, huh?
She is a total love bug, but she has bad breath.
Oh, heavens. And what can you do about bad breath in dogs?
Like with Kevin, dental care.
Okay.
It's very, very important that all animals have proper dental care. And so
I don't think people realize how detrimental bad teeth and mouth problems can be to animals.
In the same way that it's important for people, it's also very important for animals. And there are certain breeds that are more prone to having bad dental disease. And the little toy breeds like Maisie are one of them. So she had 4 root canal and she had 4 extractions.
Wow. Oh, my goodness.
Yeah, exactly.
Hey,
Hey, Maise. So
I hope you're going to cooperate
the
with
right
us,
angle. So applying a tourniquet, it's really very basic. And really, I recommend it for the limbs only. So for the forelimb or the hind limb. And you want to basically go up, if there's a break in the skin here and one of her blood vessels is actively having blood escape from the blood vessel. You want to, there's several things you can do. You can apply pressure. You can apply just manual pressure first for about, a couple of minutes to try and get that bleeding to stop. But if that's not working, one of the things that you can do is apply a tourniquet. And this is just basically a piece of gauze doubled over. And you can get this stuff either at your regular veterinarian, if they'll sell it to you, or at a CVS or any drugstore. And basically, if I'm saying that this blood vessel here, the cephalic vein, has been lacerated or cut, I'm gonna cinch this down really tightly, as if kinking a garden hose. Think of a blood vessel as like a long, narrow tube that has blood flowing through it. I'm gonna go ahead and cinch this down really tight until that bleeding stops. Now, in practice, we have...
So you'll actually see the bleeding stop.
Yes, you should.
And that's the sign that you've done it right.
And I will usually do... I'll usually do a bow of some, because then it's easier to undo. You want to have it be tight until that bleeding stops, and you want to leave it on there until you are able to get that bleeding under control. Mainly by getting her to a hospital where they can surgically, suture up, ligate or clamp off that blood vessel and suture up that wound. As far as a, I'm going to ask you to hand me that gauze right there. Both of those, actually. That'd be great.
Is that enough or just?
Yeah, I'll just demonstrate both. So in your first aid kit, there are several different types of bandaging material that you can have. This one is called Satelfa. Maisie, you stay. This is a non-stick gauze that you can apply directly to the wound. Maisie. I know there's some people watching us, they're saying, this Maisie's such a wiggle worm.
Poor Maisie.
So you can put it directly over the wound, okay? You can also even put this is an absorbent layer, okay? You don't really want to, in an emergent basis, you really don't want to put a lot of oily triple antibiotic or anything like that. You want to keep the wound clean and dry. Then you want to apply this rolled gauze, okay, that is going to help to apply some pressure and also is absorptive. This is not a sterile bandage, by the way. This is an interim bandage to get you through until you can get proper veterinary care. Maisie, you're being so brave.
Look at this.
And I know that sometimes it's difficult for some people because they're going to be alone. Not everybody cooperates. And then this is... it's kind of a self-stick. A lot of people probably recognize this from even going to human hospitals.
PT.
Yeah, exactly. Yeah, exactly. So there you have your bandage. And, again, this is not a super, it's not a sterile. Oh, Maze. And so, so now you've had pressure over the wound and you have your tourniquet. I would probably say that you can check your tourniquet every few minutes. If there is strike through of blood, you can put another bandage on there. But you leave that tourniquet on until you can get control. Yeah, absolutely. Good job, Maze. Let's leave that bandage on for the entire hour.
Have cookies for you.
That's okay.
Shame on us.
She has plenty.
Look at Maisie. Isn't she cute?
Look at that cool bandage, everybody.
Doing such a good job.
Yeah, there it is. You can apply one on the foot, and I recommend also below the elbow. Really below the elbow and below the hock is where you can put these bandages. Above, they're not going to stay right.
Thing sometimes for the dogs is cutting the pad.
Yes, very common, very common. So one of the things that we have is styptic powder. Which I don't see it, but we do have styptic powder.
Is that the same like what you use for when you cut the quick of the nails?
Yes, exactly. So if you're trimming the nails and you cut the quick and the nail starts to bleed, you can put some styptic powder on there. It's for bleeding nails only, not for open wounds. You don't want to put styptic powder on this.
But on the pad, if they hurt their pad,
if they cut their pad, which is very, very common, then I would recommend taking, like I said, a piece or two of gauze, putting it on the pad that way, and wrapping it right, exactly.
So that's pretty much the same thing.
And you really, again, you really don't want to leave that bandage on longer than the time that it takes for you to get to a veterinary hospital. So they can, take it off, examine it, properly clean it, start her on antibiotics or pain medication, that kind of thing. So,
Okay. So what happens if it's a hot day today and somebody's taking their dog out for a walk, as long as we have Maisie up here and she's doing so good, what would be signs that somebody would look for if their dog were dehydrated or having some heat exhaustion?
Right. Well, heat stroke is fairly common in dogs and cats. Mainly, we tend to see those urgent patients more being dogs because they're exercised in this weather. This weather is warm today. It's in the 90s. Plus, you have a lot of humidity. And so dogs do not perspire through their entire body. They do perspire through their feet. And so for them to blow off heat, they have to pant. But if the external temperatures are so high and they're in a situation, whether they're left outside or we've had pets that have been caught under fences, the sun is beating down on them, it's very, very humid, or also the bent-nosed breeds like bulldogs and Boston Terriers, Shih Tzus, Pekingese. These dogs have a hard time breathing in general, and then you have this hot, humid air, and so they start to pant and their airway can become swollen. The basic end result is that their internal body's ability to be able to regulate their temperature is overridden. So their internal body temperature starts to climb. And a normal body temperature in a dog is anywhere from 101 to 102. And when that starts to change and it goes to 103, 104, 105, 6, 7, 8, 9, it's very, very dangerous, really dangerous. And so also if animals are left in a car, I did see it today.
Really?
At a gas station.
Oh
I did
my
see a
God.
large Great Pyrenees, which is a winter breed,
Oh my goodness.
left in a car. If you see that, just be a good Samaritan and find the owner. Even
It doesn't take long
Yeah, it
when they're
doesn't.
in a car
It
for
doesn't
something
take
to go
20
on.
minutes.
Really?
15, 20 minutes, that temperature can get into the 100 plus
yeah.
in a car. So, these are things that happen by accident. People will leave their pets in a car thinking, oh, it's just going to be a few minutes. It's a hot day like this. It's already difficult for them to stay cool, and then this happens. And then same thing with exercising them. If it's hot and humid like this is not the time to take them for a run, even if they're used to running.
Yeah.
So when it's hot
Limit
like this,
the walking. It's
limit
really
walking,
not necessary.
go for a swim, but not a lot of intense exercise.
Yeah.
Not a lot of intense exercise. So if they truly are developing heat exhaustion or heat stroke, as we say, their internal body temperature is so high, like I said, 106, 107, 108, 109, that they develop massive inflammation of all of their body systems.
Wow.
So one of the first things that you'll see is neurologically or mentally, they'll be, they may be depressed. They may not want to get up. They might be panting. They're definitely going to be panting, laying down. Their pupils.
Not yet, honey.
Maisie, you're not going anywhere yet. But their pupils may be very dilated, which hers are probably because she's nervous. But their pupils will be dilated. If you look at their gums can be a bright brick red color. And Maisie's gums are a nice healthy pink. And she's got that horrible teeth, but she's got those are normal polka dots. But she'd have a brick red color, maybe twice the darkness of this.
Okay.
She'd have a rapid, thready pulses, which we talk to owners about how to feel a pulse. She might have a very, very rapid heart rate. She might have diarrhea, vomiting.
Okay.
Yeah, absolutely.
Yeah.
So you want to be able to cool them down as quickly as possible and get them on fluids and sometimes even plasma because their GI tract starts to be affected, their kidneys, their ability to clot their own
basically
blood.
even get a syringe and if they're not showing an interest in drinking, get a syringe and try to get them in?
Well, the first thing is being able to take their temperature. So that's, and we talked about whether we would demonstrate that with Maisie, and we may or may not do that, but feel comfortable taking your dog's temperature. It is a rectal temperature.
And it's a regular.
Should
it be a rectal thermometer that they use?
No, just
or
a regular thermometer. You can buy digital thermometer and take that.
And don't forget, people out there, if you're watching the show, you can call in and ask the doctor any questions, 781-395-5024. So if you want to call in, you might have any questions.
Yeah, absolutely.
Definitely give us a call. I know we're going to talk about even proper care for taking trips.
Yeah, absolutely.
And what's good for
yes,
pets.
if people have questions about that. So in any case, be comfortable taking your pet's temperature. And then if you see that the thermometer either goes up very, very high, or even what we'll notice is those thermometers, I think, go up to 106. If the temperature goes up to 106 and shuts off, the temperature is higher than 106.
Okay.
At that point, they need absolute emergent care. At that point,
Really?
they need to go to a 24-hour facility where they
Should
can...
they do anything, like throw a
Yes,
cold
yes,
towel
exactly.
over them or something to keep the
so the first step is recognizing, and then the second step, if they want to, while en route, would be tepid water, towels, draped over them, a fan, that kind of thing.
Yeah.
You don't want to douse them in very, very cold water. You want to use tepid water, and the goal is to bring down their temperature just in the normal range, like 102.5, 103, something like that. Bring it down. But typically, when an animal comes in with heat stroke, potential heat stroke or heat prostration, we bring them into the treatment area immediately. Usually put in catheters, start them on fluids. Start them on a lot of supportive care, oxygen sometimes.
Okay.
Check their EKG, blood pressure, do lab work.
Okay.
Yeah, so
and
it's
I know
a very
a lot
intensive
of people,
situation.
Yeah, and a lot of people ask about the thermometer, how much needs to go in, and really, it's not a lot that has to go in.
No, it's not. It's not. And again, I mean, we don't have to demonstrate.
I know.
But
Oh, the poor little girl, we're not going to do
and we
that
won't.
to
We
her.
won't. But what I tell people is, again, this is just a digital thermometer. You turn it on. And you are not going to, if they have a healthy anatomy, you're not going to, it's not going to be comfortable, but you're not going to rupture or tear anything. And if you think of the anus as the face of a clock, you just want to stick it in that much. And you can lubricate or not. You can use anything to lubricate, baby oil, olive oil, saliva. You can use anything. And once it goes in, it'll start to read. And when it's done reading, it'll beep. And it's very, and even here you can see that it's starting to read some sort of temperature.
Hey,
and so, again, a normal temperature, her temperature probably right now is about, 101, maybe 102 because she's excited. So that's pretty much it. And, that's pretty much it. So it's very easy to take it. It's very safe. People just need to feel comfortable doing it.
Yeah.
And practice makes perfect, although that's not fun, huh?
So sometimes if people are out and they've already left and they have their kit with them and they saw that their dog was having some heat distress and they took the temp, they may not have like a towel to put over them, but they should act as fast as possible to get the dog, maybe turn the air conditioner on and get to a hospital.
I would prefer, if you have nothing, I would prefer for you to know where your 24-hour emergency room is and know how to get there and get there soon. That's really the key. It's not so much, well, let me stop and cool them off. I mean, granted, if you have a moment or you want to do it in the car ride, but you're better off getting them to the veterinary hospital sooner rather than later.
Okay.
Yeah, absolutely. And as I said, in this weather, no running, no extreme exercise, or early morning, late afternoon. But even when it's in even the mid-80s and it's humid, it's this humidity that is really...
I was just going to say, probably so the humidity is the killer.
That and the temperature really can cause them to have difficulty. And then again, these, the blunt-nosed dogs, the bulldogs and Boston Terriers, all these short-nosed breeds, absolutely. And put them in front of the TV set with the clicker and turn on the air conditioning and wait for the cool weather to come.
Yeah. My God.
That's what you want to do.
Hopefully that's what they're doing tonight, and they're watching the show.
They're watching the show and saying,
with their dog,
that's a good idea. Right,
so
exactly.
definitely, if you're out there, give us a call. If you have any questions about, the summertime tips, you're going on a trip and you maybe want to make sure that you're taking the right precautions, give us a call. 781-395-5024, okay? You can ask the doctor any question.
Yeah, any question.
Yes. So, are we going to do any more?
No, I think we're.
I think she's had enough too. Huh?
Yeah, I think so too. We were just going to talk a little bit about where to check for a heart rate.
Oh, yeah.
And where to check for a pulse. Did you want to do that now?
Yeah.
And it's difficult. On TV, it's kind of hard to do, but. I want everybody just quickly to first, before talking about that.
So if you have your dog at home.
Yeah, you can just feel comfortable opening their mouths this way and lifting up the lip and noticing that Maisie's gums are nice and healthy pink and moist. And if you just press your thumb to it, you're basically pushing the blood out of that gum, and you count the number of seconds until it comes back. It should be about 1 to 2 seconds. Okay, I don't know if you can see that well
Yeah.
enough.
Yeah.
Okay, that's a healthy capillary refill time. That tells me that her circulation is good, her hydration is good.
And you can do that for cats too?
You can do that for cats too,
Okay.
absolutely. And so that's important to do, because then we can also see that Maisie needs to have her teeth cleaned. Oh yeah, yeah.
Is that true when they say a dog's nose is dry, that they're sick?
No, actually, right now you can see her nose is moist because she's licking it. It's kind of an old wives' tale in terms of the temperature of the nose or the moisture of the nose. I think if she had a fever, an elevated body temperature, you probably could feel it by touching her nose.
Okay.
But the most accurate way to tell if she has a fever is temperature.
Yeah.
Right, exactly.
Don't guess.
Yeah, exactly. And then also, it's important to feel comfortable looking in their ears. Get used to what looks normal. Like Maisie, we know that she has these pigmenty polka dots on her gums. That's normal. And she even has a little bit of pigment along the rims of her lids. Just get used to what looks normal. And then as far as checking for a heartbeat, the heart is a 4-chambered organ just like it is in people, and it sits in the middle of their chest. And if you just take the palm of your hand and slide it under her elbow, steamies. That way you should be able to, of course her heart's beating fast, but you should be able to tell her heartbeat. You can feel it there, and just by counting the number of beats that you feel in 10 seconds and multiply by 6, or 15 seconds and multiply by 4, you want to be able to get what your pet's normal heartbeat is at rest. Her resting heartbeat is probably about 75 or so, but a larger breed dog or a greyhound may have a lower heart rate, and a cat certainly has a higher heart rate, and a hamster has an even higher heart rate, and a lizard has a much lower heart rate. So it's important for your own pet to get comfortable knowing what their heart rate is at rest.
And
because
like
when
her
they're
right now, her heartbeat would be a little higher.
it might be a little higher because she's on TV and she's nervous.
And then
I doubt it. And then, taking your middle fingers and reaching inside the back leg. Again, it's difficult to see, but reaching inside the back leg, that's where her femoral artery is. And again, if you sign up for our first aid class, we'll make sure that you know how to do it. But you'll be able to feel, you should be able to feel a nice, healthy beat, and that will tell you a lot about circulation and how well the heart is functioning. So just checking,
really good things to know.
checking temperature, heart rate, respiratory rate, capillary refill time, and pulses. These things you can do quickly, and you can really assess where your pet is physiologically, and if they're sick, if they're dehydrated, if they are having problems breathing, if they're having problems with their heart, that kind of thing. These parameters will change. Absolutely. And as far as respiratory, it's just a matter of watching how well she breathes. And if you look at her, and for those of you at home, if you look at your own pet, even though she's shedding like a maniac, you'll see that as she's breathing, you can barely see her chest moving. You really can't see much effort. And if an animal has any problems with their lungs or their chest cavity or heart disease, there'll be changes here. They will have more of a respiratory effort. Their legs may be pushed out. Their head or neck might be extended. So these are things to look for. But again, it's deviation from what's normal. So the most important thing is get comfortable with what's normal first.
So know your pet, just like
know your pet.
Everything is pretty much the same as people. Know your body, the same thing when they talk about body
Exactly.
moles. So when you see something
when you see
different,
something, right. And same thing with tumors. Like Maisie does have a little flabby tumor that when she gets her teeth cleaned, I'd like to have that taken off. And, just get used to what is normal and feel your pet up and down. She's got a lot of nice, healthy fat pads everywhere. But, and
so when you feel so that's that little lump?
Yeah.
Now, is there, so somebody would feel that lump. If I didn't feel that on my dog, I would get concerned. I'd take her to the vet.
Yes, anything. Yes, if you feel something that is not that you don't think is supposed to be there.
Okay. Now, this isn't anything bad. How do you, is there some way like somebody would know? Because now, if this were my dog and I know that's nothing bad. Okay.
Right. We've done.
When would I know? What would be a sign to me that lump is something to be concerned about and not to wait for her annual exam?
Right. Well, so I'm not a fan of waiting. If you have any lumps and bumps, I'd rather have you get it checked out sooner rather than later.
Okay.
This turns out to be a fatty tumor, and we know that because it hasn't been growing that quickly, although sometimes they can, and it's been aspirated. We've done a fine needle aspirate with a needle and a syringe.
So it should never change.
No, it can.
Oh, it can?
Any of these things, unless you physically, surgically remove it and have it looked at by a pathologist, and or the fine needle aspirate, you have the slide of those cells looked at by a pathologist. That's when you know what it is. So the key is identifying it. And once you identify it, then you can know what to do with it. But any of these things can grow and change. So this I'm probably going to have that taken off because I don't want to take that chance that it will grow and change. But there are a lot of little fatty tumors, they call them lipomas, which are benign, and they typically will stay the same size. But if they don't, and it's becoming uncomfortable for them, then you can certainly have it be removed.
We have a phone call.
Oh, we do?
Oh, great.
Okay. Hi, thank you for calling.
Hi, I have a question.
Sure.
So if my dog is injured, what is the best way to transport her to get care?
If your dog is injured.
Yes.
Yeah, so we actually did not talk about emergency transport, but we do talk about it in the first aid class. So the key, it depends on the injury. If you, we'll put her down. Yeah, we'll put her down. But if you suspect that your pet has been hit by a car or has had some sort of traumatic injury, then you want to make sure that when you're transporting them, that you try to keep their head and neck as stable as possible and keep their spine as stable as possible. So for a little dog like Maisie, I'm going to have you take her.
Yes.
If you don't mind.
Yep,
For a little dog like Maisie, you can certainly wrap her up in a blanket, and that's part of this first aid kit that we have. And the other aspect of things to keep in mind is also to make sure that you're safe. You don't want to have her bite you in transport. So there's her safety and also your safety. So you can wrap her up in a blanket and put her in your car, or if she's a smaller animal, you can put her in the carrier. But the key is just making sure that she's moved as little as possible, and that's not always easy because they're painful, and even though they don't want to bite you, they may be doing that because they're afraid and they're painful. So staying calm with them, reassuring them, and trying to move them as little as possible.
Okay, great. Thank you so much.
Oh, you're welcome.
Feel free. Anybody else that has any questions or would like to give us a call, 781-395-5024. We're sitting here and we'd be happy to answer any calls. Maisie maybe too.
Yeah.
Right. So maybe, again, maybe we can talk about, because I know that was part of the topics that we wanted to touch upon, is traveling with your pet.
Right. And if in terms of traveling, and we have 4 dogs, my husband and myself, and we are going to be traveling with 3 out of the 4 this summer. And so, it's important to plan ahead. So car trips, dogs love to travel, and most of them. And if you enjoy being with your dogs, there are a lot of great vacation spots that are very accepting of dogs. And so one of the things that we do, there are several things that we do, but one of the things that we do when we travel is we make sure that we have things that they enjoy. We make sure that we have their own food. We bring it from home. We make sure that we have enough medication if they happen to be on any medication. We take a mini first aid kit with us. We also I try to make sure that wherever I'm going, I know if there's a veterinarian in the area and when they're open and where they're located. So if I happen to need additional help. Oh,
okay.
Great.
Thank you for calling. Do you have a question?
Yes, hello. Hello?
Yes, hi. What's your name?
Esther. I wanted to ask you, the vet, about my dog has recently been diagnosed. At first I thought it was just like a cyst, and at first the vet thought it was a lipoma, and it turned out after she aspirated it that it is a soft tissue sarcoma. And my Chihuahua is 17, and she recommended not doing anything because she thought it would be very slow growing. And I wondered if you agreed with that. And she said that...
I'm sorry, Esther, where is it located?
It's on her underside, above, sort of not far from her penis. His penis, I should say.
Yeah, not far from her reproductive area.
Yes.
Okay. And what and this is not, I respect all veterinarians and everyone's opinion, and I think if you ask 10 veterinarians, they may have 10 different opinions. But being elderly is not a disease, so it depends on how spry and how healthy your Chihuahua is.
Well, he is blind, and he's
He.
Pretty
Okay.
he's arthritic.
Okay, but do you that being the case, I guess it depends. It depends on quality of life, and it depends on whether this sarcoma, having it be removed, will he outlive how long the sarcoma would take to grow large to be complicating. So, a sarcoma is a cancer,
Right.
and it is a malignant cancer, and I do think it's important to try and take it off. But it all depends on whether he is a good surgical candidate.
Yeah,
You know,
right.
so that
She said
depends.
Yeah.
You know, so I wouldn't say that being older is not a disease. You know, older animals and older people need care, and so if he's even though he's blind, you know, and he's arthritic, if he's walking and he's active, and you think that his longevity would benefit from taking that off, I would recommend it, because it's slow growing, but it's not that slow growing. It is a malignancy. And again, if it's something you could talk with your regular veterinarian about, or you could also see an oncologist. There are specialists in veterinary medicine just like there are in human medicine, and at our practice, it's a separate practice, but it's in our building, is an oncology group, and they only treat cancer. So while you may decide not to do anything, ultimately, maybe seeking out an oncologist's opinion might not be a bad idea.
And where are you located?
We're located in Waltham on Bear Hill Road.
Oh.
And
okay.
so the New England Veterinary Oncology Group is also located there, and you could certainly you could see about getting a consult with them. Or you could certainly talk with your regular veterinarian again and say, I'd like to explore the possibility of taking this off, and what do you think? If you decided you wanted to do it, what are the possibilities?
Okay. Well, I appreciate your advice.
Yeah, I hope that helps. Good luck.
Thank you very much.
Thank
Sure.
you for calling,
Bye-bye.
Esther. Anybody else, please feel free to give us a call, 781-395-5024. We are talking about first aid kits that can be very handy with your pets during the summer, all year actually. Things to look for with weather like today, the humidity.
Right.
And maybe we'll talk a little bit now about traveling. I know you were starting to talk about
Right, so
taking them on trips that
Right,
they
so
will
make
be
sure
in the
that
car.
we try to make sure that they have their own beds. You know, we'll take like 1 or 2 beds, easy flat beds that fit in the back of the car that, you can get them anywhere. Pet stores, Costco has them. They can be made of washable material. Anyway, so we'll go ahead and take a couple of their beds, make sure that we have proper leashes, that they have also proper flea and tick repellent that's already been put on them, especially in the summer, because we're going to probably hike in the woods with them. Make sure that they have appropriate medications, appropriate collars with ID, that they're microchipped in the event that, God forbid, you were to be separated. And then also when we get there, is the place that we're staying, is it truly dog-friendly? Is it safe?
Yes, because you don't want to be leaving
Right.
your dog sleeping
Right.
in the
Right.
car. So it's really good to kind of check these out
check
so
all
that
these
you're
things
not.
out. And there are a lot of great resources, which I didn't bring with me today, but there are a lot of, I think it's the New England Dog Lovers, the Dog Lovers Guide to New England.
Okay.
Is it the Dog Lovers Guide to New England? It's a wonderful book. It has, so all of the New England states, it has where to stay, where to eat that they allow dogs, where to run and
that's
play.
good.
You know,
Yeah.
it's a lot of fun.
What about
So-
air travel? I wish I could take my dog with me when I go away,
Yeah.
but I know, like, it almost seems like there isn't the perfect time for air travel. I mean, they end up going in cargo.
Yeah, they're not, I mean, not all, my understanding, I have never personally traveled with any of my pets with air travel. So if the dog, my understanding is if the dog is small enough to fit in a Sherpa bag or a bag or carrier that can fit under the seat in the plane, they have to have a health certificate, they have to be properly vaccinated, all that fun stuff, and they have to be healthy. They can travel with you, and I have seen that when I've traveled. As far as larger animals, yes, they're put in another area of the plane. You know, again, I'm not here to endorse or not endorse,
Right.
but in terms of being shepherds for our animals and making sure that we want to keep them safe and healthy, I don't know that air travel, especially during these months, is the best idea. People still do it.
Right.
You know, people will go to Florida or California or even travel overseas with their pets, and if you have to, you have to.
Right.
Again, important to make sure that your pet is healthy, make sure that you have proper paperwork. Each airline will have certain specifications. And then also, traveling during certain times where it's not very, very hot or not very, very cold.
Right.
So perhaps going down to some of the warmer locations of the world in summer is not a great idea.
Yeah, because when I was checking into, taking my dog, it was saying how the areas where they keep them in the summer times can get very, very hot.
Yeah, they can get hot. And so...
And again, after what you were
Right,
just saying,
right.
it's like you can see how...
Right. It's kind of, it can be a recipe for disaster. So and there are some airlines that refuse to even transport animals in the summer months.
Okay.
And then there's the issue of losing the pet, which can happen anywhere, I assume, but making sure they're properly microchipped, that they have a proper name tag, that their carrier has all of your information on it, that you have a picture of your dog in the event, or cat or pet in the event that something happens, that you can tell the authorities, this is a picture of my dog, et cetera, et cetera, et cetera.
Right.
So it's not something that's impossible, but it does require planning. And I think car travel perhaps can be more convenient. But again, we did talk a little bit about safety in car travel. If you are going to travel with your dog in the car in the summer months, you're not going to go and leave the car in the dog in the car while you're having lunch for 45 minutes,
Right.
even if it's in the shade. So there are certain things that you need to be aware of when you're traveling with them.
And some people think that if they do that and they leave the car windows down,
Yes,
that's
exactly.
not
It's
safe
not enough.
either, because somebody could even come by,
True.
steal the dog,
Yes,
the dog,
or harm the dog. That's true. But as far as the heat
Yes.
aspect of things, rolling the windows down is still not enough. So
Yes. Don't forget, if you have any questions, give us a call, 781-395-5024. Okay, so basically, let's see here. We've got a good handle on what to use in the first aid, what to look for.
Right.
Tips on traveling, being, again, planning ahead seems to be really, really important. What about some of the car restraints? I know they have like different types of seat belts.
Yeah, there's seat belts, there's buckets that you can put smaller animals in. I'm not a fan of any dogs or pets in open flatbed trucks. So I will say that I don't know what the laws are, but I'm not a fan of it from a safety aspect.
Yeah.
Even if they're tethered, I don't think it's a good idea. And then if an animal is in the car, putting a seatbelt on them is a great idea. Absolutely.
Now, do they sell, a couple of times I've looked, how would you fit your pet for a seatbelt?
Again, you have to go to the pet store, really, to do that.
Okay.
Or you can order several sizes, and then you can see which one fits best.
I wondered if there was like a specific place. They're not easy to find.
No, they're not easy to find. I agree with you. It's not something that's that commonplace.
Yeah, and you would think, because most people travel with their dogs in the car, and the dogs love to go out in the car.
Right, absolutely.
A couple of times, even when I have my dog, and you stop short, and it's
and that happened to me today. Even
or
coming here,
I'm trying to grab her so she doesn't get hurt, and it's like, I wish I had a seatbelt.
Well, seatbelt. So several rules for car travel. Seatbelts are a great idea. I'm not a fan of having the dog sit on your lap when you're driving, and I'm also not a fan of having the dog be in the passenger seat when you're driving. Maisie, for example, wanted to come up into the, before I started the car, wanted to come up into the passenger side. I'm like, no, you're going to be in the back. We're going to tether you in where it's safe. Absolutely. So those are a few rules of thumb, because if you stop short or get into a serious accident, they're going to be the first ones that are going to potentially fly through the windshield. The other thing that I brought, which I have over here, are some, because people always ask me, in the event that I have something that goes wrong with my pet, where do I go? And also, what are your thoughts on pet insurance, which is kind of the preventative care for not just summer, but everywhere, in terms of getting insurance for your pets in the event that something happens to them. Will you be able to afford it? What are some of the ways to make veterinary medicine or veterinary care, especially in an emergent situation, an untoward situation like heat stroke or a car accident or a toxicity? All these things are things that are not expected. How do people afford those things? And I did bring a few brochures that we have at the practice. Maisie, you're not behaving very well. Maze, come here, buddy.
Come here, honey.
Come here, Maze. You know, we're not leaving yet.
Ah, you
Maisie,
look so
come here.
cute with your little bandage
Come on,
on.
Maze.
Look at that.
Maisie, come here.
Come on, Maze.
She's like, no, baby talk's not going to help. In any case, one of the things that we offer, which you can get anywhere, is Care Credit, which is a this is not pet insurance, but it allows you to at least Invesco and pay interest free for up to a year.
Okay.
We pay the interest and processing piece, and again, when you're forced with seeing that your pet needs extensive care, it's just something. And it's on our website. You can go to their website, carecredit.com. And then, yes, there's several companies out there. I do recommend pet insurance. It's an indemnity plan. It's not something that is going to completely rid you of the financial responsibility that you have for your pet, but veterinary pet insurance is a good one. Pet's Best is another great one. That's the middle brochure. ASPCA has a plan. We also got visited by Trupanion, which also seems to have a really great plan out there.
And is this medical care like the annual exams?
Well,
or is this
there are wellness plans that you can also sign up for that they offer discount dental care. Discounted dental care. You got her?
Yes.
Discounted dental
Come
care,
here, baby.
vaccines. But then also, I think this pays for, when you have an untoward expense, that's when it really is beneficial. And it works out to be, I would say, $25 to $40 a month.
Okay.
So it's not that much.
Right, when you think of. And what does the average insurance cover? Because I know when you take your pet it needs an annual exam, vaccinations.
Right. So you can elect to have a wellness plan, and it'll offer you, again, a percentage off of what your wellness exam, vaccines, heartworm, preventative dental care, that kind of thing, spaying and neutering. And then for when there is an accident or they need surgery or blood transfusion or something like that, usually these insurance companies break it down and they give a certain percentage of each item that's on the invoice. So it's very easy. The paperwork, it's a reimbursement style plan. And none of the veterinary practices are affiliated with them. These are all separate companies. And the pet owner signs up for them. And typically it's a very fast reimbursement. You fill out simple paperwork. It's a one-page paperwork. You send in that plus the invoice, and the insurance company reimburses.
Okay. Well, our show will be coming to a close. We're very fortunate tonight to have Dr. Amy Schroff with us. If you'd like to call in and ask any questions, our phone number is 781-395-5024. We're talking about pet safety tips that can help you through the summer months for, vacation travel. So please give us a call. The number is 781-395-5024.
You can ask any question.
And as I was telling you earlier, Dr. Schroff is, part of our pet program, the pet network that we have, and I'm really happy that you came on the show, we're trying to promote educating the public about being responsible pet owners. It's part of an action plan because the ultimate goal for Kitty Connection is that we will have spaying and neutering being an ordinance for the city. It's just so important.
It really is. It really is.
I don't think people realize that the health benefits, again, even in spaying and neutering.
Right. There are health benefits in terms of preventing certain diseases. Ovarian and uterine cancer, anal cancer. There's a lot of different diseases in the female dog and cat, and then also same thing with male dogs and cats. And then also, there's one cat born every 7 seconds in this country, and I think it's even worsened. There are 14 billion pets, 14 million or 14 billion pets euthanized every year. Yeah. The shelters, we work very closely with you and also with Animal Rescue League and a lot of groups. And, they're just, the communities don't know what to do with all of these animals. So it is important to neuter them. There are a lot of low-cost spay and neuter clinics around, and it just really takes away so many problems and issues.
And one of the things that we were lucky about, I know we were telling everybody, we had the Catmobile come to Medford. They came on Wednesday, June 29th. We talked to Stacy, and it was a big success, and they are coming back to Medford.
Oh, that's terrific.
Again, we're really excited because this is our goal, is trying to bring
affordable pet care to
Yes,
people.
absolutely.
And encouraging them to spay and neuter, because it's
Yeah,
win-win for
preventative care-
everybody.
Preventative care and pet insurance are great tax to follow for taking good care of your pet.
So we'll be telling everybody, and we'll have it constantly going through on TV3. August 25th is going to be the next time that the Catmobile is going to come to Pet Supply Plus. They'll park the van there and be able to spay and neuter anybody that needs low-cost spaying and neutering for their cats. They're going to continue to come, so please spread the word. I'm really happy that we're able to do that. And if you do need any help with low-cost medical care, food, definitely please call Kitty Connection at 781-393-9995. Our goal is to keep you and your pets together, living happy, healthy lives.
Absolutely.
Last-minute call, 781-395-5024 if you have any questions. Again, Dr. Amy Schroff from Vescone in Waltham.
Yes, 180 Bear Hill Road.
Yep, and basically emergency care,
Specialty
expertise
care.
in you were saying too, you have cancer specialists there?
Yes, the New England Veterinary Oncology Group is a separate practice in our building, and they provide that, but we also have surgeons, an ophthalmologist, and radiologist, and a blood bank. So we have a lot of people that can give advanced care.
And it's always great too, like what happened to us with Kevin is
really
it
glad to
never
be able to hear that.
hurts to get a second opinion. I think most vets that I know of welcome second opinions. So
yeah, we work a lot with area veterinarians. So.
Absolutely, and it can make a difference because sometimes animals can't talk, and you have to make the best decisions based on the information that pet owners or in our cases foster homes are diagnosing. And sometimes to find out the answers can be very, very costly. So seeking out alternatives, second opinions, I think is definitely a great way to go. Thank you everybody for watching the Pet Network. We will be doing another show next week, so stay tuned, and you can watch reruns on TV3 and on the Kitty Connection website. Thank you for watching.